Hello, welcome to my channel. So today we are going to go through case studies and literature review. So station is saying this is a female. This is a 15-year-old girl who presented with primary amenorrhea. And primary amenorrhea, she has normal female secondary sexual characteristics. What is your diagnosis? What is the appropriate treatment for this case? Mention 3 symptoms other than amenorrhea that she may present with. What other investigations might you perform on her? Then what is her genotype? Chromosomal analysis likely to be. Okay. Then the definition for this case is that we are talking about imperforate hymen. So what is hymen in short? So how do you define hymen? Okay. So the hymen is a membrane that surrounds or partially covers the external vaginal opening. That's the definition. Then what's the effect of sexual intercourse on the hymen? Are usually variable. So one, the effects are if the hymen is sufficiently elastic, it may return to nearly its original condition. That's after sexual intercourse as well. If it's sufficiently elastic. Then in other cases, there may be remnants or it may appear completely absent after repeated penetration. Then the other cases is that additionally, the hymen may be lacerated by disease, injury, or medical examination, or masturbation, or physical exercise. Then, for these reasons, the state of the hymen is not a conclusive indicator of virginity. So that's the thing you have to know about the hymen. Okay. Then types of hymen, we can have annular hymen, which is where the opening is in the center. We can also have a crescentic or semilunar, where the opening is placed anteriorly. We can also have a cribriform, where the hymen has multiple openings. We can also have a septate, where the hymen has a thin strip of tissue present in between 2 lateral openings. You can also have a fimbriated hymen, where the opening of the hymen is in the center, but the margins are wavy or undulating. That is a fimbria. Then it also shows multiple notches. You can also have an infantile one, where the hymen have small and linear opening in the center. Then we can have an imperforate hymen with no. You can have imperforate hymen where the hymen has no opening. Then you can also have an absent hymen. So in some cases the hymen may be congenitally absent. It's not just there. Then you can also have a marginal hymen where the hymen is in form of a thin rim with larger opening in the central part. So it's just covering the margins. So these are the types of hymen. So those are the pictures. So this is annular hymen. You can have a semilunar hymen. So you can pause and go through them. This is cribriform, then this is septate, then this is fertile, then fimbriated. Okay. Then I also add another so that at least you familiarize yourself with this. So this one here is a normal anatomical variation of the hymen. That's the normal. Then here is the imperforate hymen. Then here is the micro perforate hymen. Then here is the cribriform hymen. Then here is the septate hymen as well. Okay. Then imperforate hymen. So let's now talk about imperforate hymen. So imperforate hymen is a congenital disorder where a hymen without an opening completely obstructs the vagina. Then it is caused by a failure of the hymen to perforate during fetal development. Then it is the most common obstructive anomaly of the female reproductive tract. Then it occurs in approximately 1 out of 100, 1 out of 1,000 newborn girls. Then it is most often diagnosed in adolescent girls when menstrual blood accumulates in the vagina and sometimes also in the uterus. Then it is treated by surgical incision of the hymen. Then that's an imperforate hymen. So as you can see, these are the labia. Uh, this is the labia minora. Then the labia majora is this side. Then in between, that's where we have the imperforate hymen itself. Then this is more. This is also another illustration in between here. That's the imperforate hymen. Okay. Then signs and symptoms in newborns may present with acute urinary retention. Okay. Then in adolescent, the most common symptoms are cyclic pelvic pain and amenorrhea. And other symptoms may be associated with hematocorpus, which is a medical condition in which the vagina fills with menstrual blood. So it's called hematocorpus. Then the symptoms include urinary retention, constipation, back pain, nausea, and diarrhea. Okay, those are the uh, other associated symptoms. Then complications, we can have peritonitis where there is inflammation of the peritoneum. We can have a mucometrocorpus, which is dilatation of the vaginal canal and uterus due to mucus accumulation. Then we can have the commonest, which is hematometrocorpus, which is dilatation due to accumulation of menstrual fluid. We can also have UTI, which is urinary tract infection. We can have urinary retention and constipation. In terms of management, so before surgical intervention in adolescents, symptoms can be relieved by the use of combined oral contraceptive pills and taken continuously to suppress the menstrual cycle or NSAIDs to relieve the pain. Then surgical treatment of the imperforate hymen by hymenotomy, which is removal or opening of the hymen. Okay, so this is after they do hymenotomy, then they do passive drainage of blood. So that's menstrual blood going in the kidney dish. Okay, so this is also another picture showing a cruciate incision being made on the imperforate hymen. Then after that, then they suture the mucosal margins. Okay, so this is another picture. Then that's the end of the case study. So in terms of that's the end of the literature review. Then for the case study, the answers we can have. You have to know that in terms of diagnosis, this is an imperforate hymen with hematocorpus. So there is accumulation of menstrual fluid. Then what is the appropriate treatment for this case? So of course you have to incise the membrane. So you have to do a menectomy or cruciate incision, like we talked of in the literature review. Then mention 3 symptoms other than amenorrhea that she may present with. So she can have a cyclic or intermittent pelvic pain, vaginal bulge, urinary retention, dyspareunia, and those constipation that we were having, because dyspareunia is painful for sexual intercourse, and which of course might come in if we at all she was to try and have sex as well. But if she hasn't tried that, then of course she won't feel the same. Okay, then what other investigation might you perform on her? So investigations can do ultrasound to confirm the presence of a normal uterus and ovaries. Okay, then what is her genotype or chromosome analysis likely to be? So it's just going to have a normal 40XXX chromosome. Okay, so that's the end of the tutorial itself and the literature review. So if you haven't subscribed, please subscribe and hit the bell notification, and check out other tutorial video as well, so where we do case studies and literature reviews, so that you have a lot of sufficient information as you answering the case studies rather than just going through the case study alone. Okay, so thank you for watching. Please subscribe and hit the bell notification, and also share the video to people you think they are going to benefit from. Okay, so see you on the next tutorial.